One of the real advantages of electric cooperatives membership is having a voice in our state's energy future.
Not a week goes by without important energy issues making headlines. These are issues that need to be discussed. And you should know that as policies are being developed, the cooperatives are looking out for our members, advocating what's best for you.
We are your friends and neighbors.
We are your local electric company.
The electric cooperatives.
We are Arkansas.
You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
And welcome back to Capitol View. I'm David Goins alongside Roby Brock. We are joined now by our Sunday morning political long table, Insurance Commissioner Jay Bradford to my direct right, a little further, State Senator Jonathan Dismang, second appearance on Capitol View. Gentlemen, thanks for both being here this morning.
First question, so glad to have y'all. First question for both of you, and Commissioner Bradford, maybe we start with you on this. Obviously, a lot of anticipation on Monday. We're going to learn, the public's going to learn at least, what these health insurance rates in the exchange are going to be. Everybody wants to know, are we going to be ready for the exchange on October 1st?
Well, that's certainly a very pertinent question. It's not going to be easy to get there by October 1st. It's going to be it's an arduous task. Everything's coming together at once. You've got the federal system, we've got our state insurance system, the Medicaid system, all blending in for this whole project. No one's ever done it before. We're learning as we go, and I'm not just saying the insurance department. I'm talking about our Medicaid section of our human services and the federals too. We'll get there. It'll be a bumpy road, but we're up to the task.
Senator Dismang, I know there's a lot of legislative concern about October 1st being a good opportunity to flip that light switch on. What are you and your colleagues worried about? What are you anticipating?
Well, I think the most important thing that we're looking for right now are the rates, and we're still waiting on those to be released and have some assurances. We hope from the feds that that'll be Monday. We've talked about that probably being the biggest hurdle, first hurdle at least for the private option, and so looking forward to those. And just like everyone else, we're worried about the setup, how it's going to work, making sure that the system itself flows well and that folks are able to navigate efficiently. And so, that's wait to be seen. It's not tested, and so there are some concerns there.
Yeah, if I'm a consumer, I don't have insurance, I want insurance, what am I going to learn on Monday when these rates come out?
Well, there'll be hopefully in plain language for people to understand, and that's what we're going to attempt to do. We'll have a press release sometime Monday, depending on when we get the rates. It's my ideal for us to have examples by age and by the different categories, so someone could say, well, if I'm 31 years of age, I make $30,000 a year, I have 3 children, this is what it's going to cost. And then there'll be a lot of resource information in there where we're going to have guides out in the field to help people. Their health offices are going to be geared up to help people, to advise them. The district office of human services will be. Lots of nonprofits. Over 500 agents have been licensed to sell these products. There'll be hundreds more coming on as time goes by.
Is it this simplified? Because this is how it's been explained to me, is that you're going to have 4 insurance carriers that are offering maybe 3 different levels of plans, bronze, silver, gold. Yeah. The variable is age, obviously, because a 25-year-old may pay less than a 55-year-old. And then the other variable is income, because that might determine some subsidies or credits that you might be qualified for.
Whether or not you smoke.
And non-smokers.
Yes, smokers, non-smokers. Those are the big questions that people will need to answer, and they're going to need to know what their income is. You see.
If I already have insurance through my employer, like a lot of Arkansans do, given the various jobs they have, do I pay attention to October 1st?
Most people that have insurance as their employer are not going to be affected by this. You would have a choice if the employer's insurance is over 9% of your income, then you could go to the exchange if it's to your advantage. That will not be the case on 99% of the issues. They'll stay just where they are. And people of my age and younger than my age that are on Medicare, this does not affect that population in any way whatsoever. There's a lot of misinformation. We get a lot of calls from people who don't want to change that system. This doesn't do it at all. So
you've gotten calls of people worried that something's
yes.
going to change.
And you know, people in that age group are very, very sensitive and don't want anybody to disrupt those programs. This does not have anything to do with that.
You talking about the Medicare age group?
Yes.
Okay. Yeah.
Yes.
Senator Dismang, what are you, I guess, perhaps anticipating the most? What are your expectations in terms of the population that this system is designed to address? What are you hoping the big takeaway is?
Well, I mean, I think that, right now a lot of small businesses aren't able to provide insurance, and you have working families that do not have coverage because they're not able to afford it. Hopefully those individuals will be able to take part in the system. Hopefully the rates are so that it financially works, and they're able to gain some coverage and help, have a little bit more direction, control over their own health care.
Now, these are all going to be individual plans, though. There's no family plans that are going to come out in this exchange, correct?
That is right.
All right. So I'm a small business owner. I've got under 50 employees. I am providing some health insurance right now for my employees, but I'm looking at probably some pretty steep rate increases. Is this exchange going to be the place for me to look for those employees to find more individual plans? How do they cover their families?
Well, I think it's just a decision that the family will have to make, and on the business side, I think it's a decision that the entity itself will have to look and see what makes sense, for how they offer coverage in the future. But again, I think that's a decision that'll be left with the families and the business owners, employers.
What the studies say that most of those small businesses they have an agent, and those agents are going to be a very important part of the conversation about the proper way to go. We do know that there are tax credits for the small business for the contributions they make for their employees, and they can deduct their own insurance. There should be a really appetite in the small business community under 50 to go into these programs. I think it's going to really be advantageous to that group.
All right, let's take a quick commercial break. Let's come back for another round of questions with this. I'm Roby Brock. When we come back, more with Senator Jonathan Dismang and Insurance Commissioner Jay Bradford. I'm Roby Brock alongside David Goins. You are watching Capitol View on Sunday morning on KARK.
Farm Bureau helps protect its members in more ways than you might think. They've always been the voice of agriculture in Arkansas, working on behalf of folks like me when nobody else would. And Farm Bureau stands for the values that Arkansas families care about. They've protected my right to farm and make a living, which helps everybody who likes food on the table. You know what they say, Arkansas counts on agriculture, and agriculture counts on Farm Bureau.
You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
Welcome back to Capitol View. I'm Roby Brock alongside my co-host David Goins. We're joined by our panelists this morning. We've got State Senator Jonathan Dismang from Searcy. We've got Insurance Commissioner Jay Bradford.
Yeah, gentlemen, kind of jumping back where we were talking about, the majority of Arkansans have insurance. I think I saw a number about 84%. Have insurance, maybe nationwide, and this would get it up to 95% coverage, this, expansion under the Affordable Care Act plus private option. Okay, so how do we reach those who don't have insurance, which typically those can be, maybe the toughest population to reach? I know I've seen billboards out there, we've seen TV ads. How do you gauge how effective this is to get folks signed up? I'll start with you, Jay.
Well, that measurement is just getting ready to start as of the first of next month. And I think I want to stress that nothing will be effective until January the 1st. Right. This is a processing period, and we're going to be learning as we go. The contracts that we have for the education piece, that includes the advertising that you see in print and on television and over the airways. They have a tracking system that's built into their contract to see how effective that their message is getting across at that point in time. Obviously, they started off with focus groups and various scientific methods by which to hone the message to get people to understand what the process will be. The second phase, which is still actually in the hands of the legislature now to authorize, is to guide them to the federal exchange. How do I get there? Mm-hmm. And so we're working on that. The legislature asked to hold that until the rates come out, and they'll make their decisions based on those facts. I want to take this opportunity to say, though, Arkansas is standing very, very tall with this private option. And Senator Dismang and some of his colleagues are to be commended for this. This is a privatization of a public system. It's private commerce. We'll regulate it. Your insurance department will regulate these policies just as they do everybody else's policy. It is an excellent process, and we get calls daily from other states that want to duplicate this process.
Senator Dismang, let me ask you this question, because you got Commissioner Bradford here. You can even interrogate him if you want to a little bit. But I mean, there are a lot of
he's done that before.
There are a lot of legislative concerns. There are concerns that some of the IT infrastructure that's got to be in place to handle this volume that's coming may be behind schedule. There are definitely concerns from legislators about the spending for advertising to promote access to this. So, I mean, what do you still need answers for, and your colleagues still need answers for from Commissioner Bradford in order to feel more confident about the direction that this is going?
Well, I mean, I think specifically, again, it goes back to the very first thing that we have to even really have the discussion are the rates, and that's the reason you saw the legislative committee, legislative council. We've postponed legislative council and the vote on that until after we get the rates. So that'd be postpone the vote on future advertising if there is going to be that type of advertising.
Is that like a carrot and a stick thing? You want to see those rates that you give them permission to go, or do those rates tell you something that seems to me to be independent of promoting and advertising this program?
Well, I mean, I think the rates, I mean, again, that's the first big hurdle. I mean, if these rates come in higher than what the actuaries estimated during the session, then I think there'll be an issue with the private option, and perhaps the theories that we utilized, don't kind of let themselves come to fruition. But I mean, if they come in the mid 400s per month, then I think that we have something that we're able to work with, and I think we have a model that has some promise to it. And so again, I think that the thing is not get ahead of ourselves. Let's make sure that the rates come in where they should, and then we could move on with some of this other discussion.
Are the rates going to come in the 400s?
You know, I can't guarantee anything now. I think I was quoted yesterday somewhere. I'm very optimistic, but let me tell you, I'm an optimistic person, and so. But I think that Arkansas is going to be. I think we're going to be. It's going to be a doable situation. We'll know more about it, and Senator will come Monday, but I'm optimistic.
Senator Dismang, just so I understand you correctly, if the rates came in higher than expected, more than the mid-4s, would that lead to an erosion of support for the private option within the legislature?
Well, I mean, I think, like I said, I'm not sure what the magic number would be as far as where the rates are, but I think that, again, a lot of this has been based on conservative theory in regards to premium price support, and so we're waiting to see right now if the actuaries were right back during the session with their estimations that it would be in the mid-4s.
If they're wrong, would that change your thought on?
Yeah, I mean, if they're tremendously higher, then absolutely. Yeah, I mean, I think it changes the game in the discussion, and I think that then things would have to be reviewed.
Commissioner Bradford?
One thing we need to recognize that this is affordable health care is a tremendously broadened scope of coverage for Arkansans. I mean, these essential benefits are well defined. We've all know that people who've had terrific trouble getting insurance, if they have any health issues whatsoever, that's going to go away. People are going to be able to secure insurance policy without exclusions or without write-ups on it. There's a cost for all that. It's a cost benefit. But I still feel like we're going to be fine. We just got to recognize that we do have a protection here that it's going to have to be paid for, but it's going to be worth it. It's going to be value added.
Jay Bradford, Senator Jonathan Dismang, we're going to stop right there. I appreciate the time this morning, talking a lot about the private option. We'll certainly have a lot more going forward. Welcome back to Capitol View. We'll be back right after this to wrap it up.